Oh, dear loving visitors, we are happy to receive you. You just feel at home. We are happy indeed. Oh, dear.
The Vassar Uganda Project is an organization that seeks to improve life in Uganda by promoting sustainable health care. The Vassar Uganda Project works to empower the people of Uganda by coupling educational, preventive, and primary healthcare programs designed in consultation with and executed through locally based health initiatives. Programs address some of the most prevalent medical conditions in Uganda: malnutrition, malaria, complications of pregnancy, and death and injury related to lack of access to healthcare attendants and facilities. Major projects include the Goats for Widows program, mosquito net outreaches, and strengthening the health system in Iganga, Uganda. The Vassar Uganda Project Goats for Widows program selects widows and widowers who are having trouble supporting themselves and their children to receive milk-producing goats. Scovia received a milk-producing goat in January of 2009. Her husband had died suddenly, she thinks from a heart attack. Scovia greeted the Vassar Uganda Project volunteers warmly. Scovia has 8 children that she is trying to support on her own. She was expecting another child at the time she received the goat. To ensure that the program is successful, Scovia and other goat recipients receive animal care training and free veterinary care for a year. With Vassar Uganda Project funding and help from other villagers, Scovia has also constructed a shed that will keep the goats safe at night and begun to grow food for the goat to eat.
And Scovia is also very grateful for this assistance which has been given to the sympathizers from America. She's very happy, and she has hope in all in that goat, and is expecting to get milk for the children, cash for school fees to take the children to school, and the upkeep of every day. She's ready to rear the goat. She's willing to do it better. She's willing to keep the goat.
The goat's first and third offspring will be donated to other villagers in need. Scovia said she hopes that her children will have a brighter future as a result of the goat, which will provide milk for Scovia's children and income so that they can go to school.
Mostly the biggest health concern here would be malaria and tuberculosis. So, like for instance, in the pediatric ward, we have 36 beds for the patients, and usually we have about 50 or more babies. And in one day, when I was looking to see what the diagnosis was for the children, only 8 of those 50 children didn't have malaria.
Malaria is a leading cause of sickness and death in Uganda, especially among young children. It is transmitted from person to person by mosquitoes. The best way to prevent malaria is to sleep under an insecticide-treated mosquito net. The Vassar Uganda Project partners with the nonprofit group Soft Power Health to educate villagers about malaria and the need to use mosquito nets.
So Mrs. Anopheles needs your blood in order to feed her eggs. Now the male mosquito cannot give you malaria because he only feeds on fruits and plants.
Katibana eri ensi eno ensi y'abankazi ng'ekika kya Anopheles ensi eyeru mabwire bwonka n'esansaanya endwadde y'omusujja ogw'ensiri.
The Vassar Uganda Project sells mosquito nets to villagers at a highly subsidized rate. Soft Power Health will follow up with each family that purchased nets to make sure they are being used correctly.
a total of 82 nets today, so we took everyone's name and village and everything, so we'll come back in a few months to see if everyone's using them correctly. So now we got plenty of kids to sleep under an akatimba every night. Yay! Look here!
Yeah.